Hi, my name is Alexis Vandergrift. I'm a student nurse at Southwest Baptist University Mercy College of Nursing and also a part-time preschool teacher at James River Church. Today I will be addressing Billy Long, our U.S. representative, and I'll be covering the bill called Eat for Health Act of 2017, or it may be cited as Education and Training for the Health Act of 2017. This bill states to require the Secretary of Health and Human Services to issue to federal agencies guidelines for developing procedures and requirements relating to certain primary care federal health professionals completing continuing medical education on nutrition, and to require federal agencies to submit annual reports relating to such guidelines and for other purposes. I am in support of this bill, and I will give a couple reasons. My education of this bill comes from govtrack.us/congress/bills. My first supporting issue is that I think primary healthcare physicians should be required to know their nutrition on how to educate a patient about nutrition, because a diet can affect somebody's life drastically. I think that patients who have new chronic illness diseases should be able to go to their doctors, and they should be able to learn not only just the pharmacological classes of the drugs they can take, but also the diets that they can start consuming so that they can feel better about themselves without just the medicine. I think that with cardiovascular disease, obesity, diabetes, and cancer, they could all be improved in America if we just changed our diets. I think that many people think that they can just eat what they want and live happily ever after, but when you're 50 and you're a father and you're having a heart attack because you ate a bunch of fatty foods the rest of your entire life, the only thing you would want to do is change your diet so you can stay with your family longer instead of shortening your life. The second point I have is that I think that with the federal agencies checking up on the doctors, I think that's a very good idea for annual and biannual checkups on their education of nutrition, because I think that the doctors will keep it fresh in their brains, and that way it can get out to all their patients on a daily basis. They can focus more on the diet instead of the medicines, like I was saying, and they can remember to tell each patient how they can help their lives change their lifestyle so they can change their life, so that they can live a longer, happier life with their family. And I think that should be ingrained into patients' minds as they are in the hospital for precursors to chronic diseases. And I think that a good diet will drastically decrease the number of chronic diseases in the U.S., and that will lower the bills that many people have for healthcare reasons. And as a nurse, as a future nurse, I would want the education to tell my patients how they can better themselves with just their diet and how that can make their life that much longer. I support this bill for many reasons of how it will affect the future of America and the health that we have. Thank you.